Welcome to this presentation on neuroleptic malignant syndrome in psychiatry and medicine. I'm Dr. Prosper Tettey Doe in the United Kingdom. This is a very important topic, which is NMS for short, has an incidence of 1% worldwide, and the mortality is up to 20%. And it also has some medical complications in 40% of those who are affected. Now, this condition, the onset is usually any time of between a few hours to months after an antipsychotic has been given to a patient. And the mechanism is not known. It's idiosyncratic. You don't know who is going to have this neuroleptic malignant syndrome or not. And the features are as follows. There's a fever, which may be mild, and altered consciousness. And there are also what we call autonomic features, such as tachycardia, labile BP, sweating, pallor, respiratory rate increased. And there's muscle rigidity also, which is not relieved with anticholinergic. In laboratory findings, we find the creatinine phosphate, creatinine phosphokinase, CPK, is elevated. There's leukocytosis, there's increased potassium and reduced magnesium. There is also anemia associated, and there's increased ESR. There may be proteinuria, and there will be EEG findings which show slow waves. The risk is more in males compared to females, and also the risk is increased in brain disease and also increase in exhaustion and dehydration and affective disorders, be it depression or bipolar affective disorder. It's also increased in neuroleptic naivety. That means those who have not been given neuroleptics or antipsychotics in the past, and it's their first time. Now, about the assessment, vital signs are important. So check the temperature, the blood pressure, the pulse, and the respiratory rates. And the physical and neurological examination is very important. And the mental state examination is also important. In the laboratory, request for urgent CPK, urea and electrolytes, full blood counts, and then urine also is sent. From the guidelines or management in psychiatric units or in medical A&E. Now, in psychiatric units, start with withdrawal of the antipsychotic. So stop the antipsychotic which is causing the problem, and monitor the vital signs and involve the medical colleagues urgently. The next step is in the medical A&E, where there's rehydration as an intervention, and bromocriptine is prescribed, which is a dopamine agonist. Dantrolene, which is a muscle relaxant, is also prescribed, and benzodiazepine, and ECT for psychosis, and artificial ventilation may be needed. Now, there's a need to restart the antipsychotic after all these treatments is done. Initially, stop the antipsychotic for 5 days at least and begin with a small dose and with a slow increase whilst monitoring the response of the patient. Monitor the physical and biochemical features as outlined previously. So this is the presentation end of Neuroleptic Malignant syndrome. And I wish you all the best in your career and also in your studies.